Hello, everyone. My name is Sherry Pham, and I'm a Child Care Program Specialist in the Oversight and Accountability Division from the Office of Child Care. And on behalf of Dr. Ruth Friedman, I just wanted to welcome you all to the Sub-Cohort Training. You've been invited to participate in this training because your state will be going through the Office of Child Care monitoring process over the next 6 to 8 months. The purpose of this session is to review and provide additional details of the Office of Monitoring's processes that were discussed in the confirmation email that you've hopefully received. We're going to go into detail about the process, and we want everyone to feel comfortable asking questions as we go along. So remember, you can do that either by chiming in verbally or typing your questions in the chat box. In addition to hearing from me, you'll also be hearing from Anjali Redwood, who's a Child Care Program Specialist in the Oversight and Accountability Division. And we also have Toya Bryant on the line with us from OCC as well. And with that, I'll turn it over to Kara, who will introduce the WRMA team.
Hello, everyone. This is Kara Lenhart, and I'm the Learning and Resource Lead for WRMA on the OCC Monitoring Project. And I'm joined today by 3 other co-presenters from WRMA, including our Project Director, Mary Sprague, Leslie Blazer, one of our monitoring liaisons, and Jesse Farley, another monitoring liaison, and we're happy to be here with you today. Sherry?
Thank you, Kara. So here are today's objectives. The first is to really share what's new for monitoring in Cycle 2. We'll be reviewing the pre-visit phase of OCC monitoring, where we'll walk through the compliance demonstration packet, which is both the compliance demonstration chart as well as the document submission chart. We're also going to discuss the different approaches to demonstrating compliance and discuss the 3 pre-visit planning calls, and then we'll go through our next steps. So first, we want to provide a quick background for those joining this training who have not been involved in previous orientations related to OCC's monitoring visits. So let's begin with the regulatory authority for OCC monitoring. The Ccdf regulations at 9890 of Subpart J require HHS to monitor programs for compliance with the Child Care Development Block Grant Act of 2014, the Child Care Development Fund Final Rule, as well as the state's approved Ccdf plan. So OCC will focus its monitoring efforts on the lead agency and the lead agency's efforts to implement the program, whether directly or through contracts and agreements, in compliance with the Ccdf regulations and the state's approved plan. OCC's monitoring was developed to meet 3 primary goals. The first is to ensure compliance with the Ccdf regulations and approved Ccdf plan, to identify technical assistance needs to meet Ccdf requirements, and then lastly, to identify promising practices to inform continuous quality improvement. If you haven't already, please complete the National Monitoring Overview Training for additional background on the OCC monitoring process. You'll find a link in the resources pod to the registration. So let's talk about what to expect in Cycle 2. First, OCC has continued to work to include all the feedback and lessons learned throughout Cycle 1 into the process. Since the process has been streamlined along the way, there are no major process changes for Cycle 2. OCC monitoring teams will continue to coach states through the process and to seek feedback throughout all 3 phases of monitoring. As you learned in the National Overview Training, there are new topic areas for Cycle 2. So here's a list of the topic areas for Cycle 2. You'll note there's a slight difference here in the order from the list that you viewed during the National Orientation Training. We won't dig into the topics right now, but we will take a deep dive into them in just a few minutes as we walk through the compliance demonstration chart. So as you can see here, the monitoring topics for Cycle 2 carry over core elements of the Ccdf program from Cycle 1, such as 12-month eligibility policies, health and safety standards as well. They also build on priorities outlined in the American Rescue Plan, such as building supply of child care and payment policies. So based on the FY 2022-2024 plan review and approval process, OCC will be issuing preliminary notices of noncompliances as part of the plan approval. If these noncompliances fall under one of the monitoring topics, the monitoring team will follow up on any progress the state has made toward coming into compliance. So during the monitoring itself, the state may provide the monitoring team with evidence of progress made toward compliance, but OCC will not be issuing an additional noncompliance for the same regulations. So monitoring is a point in time and will focus on implementation as of October 1st, 2021, which may include new or different policies and practices implemented in response to some of the expanded funding that was provided through the Coronavirus Aid, Relief, and Economic Security Act, the Coronavirus and Relief Supplemental Appropriations Act, and the American Rescue Plan Act. This is different from Cycle 1, where we focused on pre-COVID implementation for states that were monitored during Cohort 2 and 3. Given the point-in-time focus for Cycle 2, it'll be really important when thinking about how you're going to demonstrate compliance with the specific Ccdf provisions to really think about the types of evidence your state will need to provide to address your current implementation of the program. This will be particularly important when thinking about program integrity. We'll talk more about what kinds of evidence you might want to provide that would be appropriate to demonstrating your state's implementation later in today's session. But remember that monitoring is a point in time look at compliance. The OCC monitoring team will review the state's compliance with each of the monitoring topics up to and including the time of the on-site visit. So lastly, OCC will be releasing new resources to support you through the monitoring process. Watch for an announcement regarding the new webpage with monitoring resources designed to help you during each phase of the monitoring process, and a new training explaining what to expect during the guided case file reviews. And with that, I'm going to turn it over to Anjali, who will walk us through the 3 phases of monitoring.
Many of you who participated in Cycle 1, you may recall that there were 3 phases of monitoring: the pre-visit phase, the on-site phase, and the post-visit phase. This will remain the same for Cycle 2. For any additional information or detailed description of each of those phases of monitoring, you can take a look at the National Overview handout available in the download pod. For today's training, we will primarily be focusing on the pre-visit phase. Any additional detailed discussions related to the on-site visit or your post-visit phases will occur in your individually scheduled planning calls. Today's training will be described as a typical monitoring process, which includes an on-site visit to your state. We want to stress that we know how valuable on-site visits are to the integrity of monitoring. We hear this again and again from our monitoring teams. However, in the event that the visit to your state cannot be conducted in person due to a national or a local emergency, the monitoring team will reach out and plan a virtual visit as an alternative to the on-site visit. Should a virtual visit be deemed necessary, we'll be working with you to develop a virtual visit schedule. The virtual visit sessions will be held in an online virtual meeting platform called Adobe Connect. WRMA will provide technical support for state participants, including test sessions if needed. Again, stay tuned. The monitoring team will be in discussion with you during your pre-visit phase to determine if emergency measures are needed. Next, I'm going to pass it to Kara for discussion on the pre-visit phase.
Thank you, Anjali. So now let's take a look at the pre-visit phase of the monitoring process in a little more detail. So as we mentioned in the National Orientation Overview Training, and is also the same as with Cycle 1, we want to acknowledge that the largest workload for states within the OCC monitoring process is in the first phase of monitoring, the pre-visit phase. And states have acknowledged that this is a little different from many of the monitoring or auditing processes that they've experienced in the past, which may tend to have minimal pre-work, but significant work while the team is on site. And within the OCC monitoring process, the heaviest lift is the document submission submission process, which comes in the pre-visit phase at the beginning of the process. Submitting the requested documents and doing so within the time frames does take some time. However, spending effort on the process and submitting everything within the time frames provided allows the process to go smoothly and is designed to really lighten the lift of the visit. So let's talk about what's involved in the pre-visit phase. So this slide should look familiar, similar to Cycle 1, and provides a high-level flowchart of the state pre-visit activities. We want to note that you can refer to your own state monitoring activities document that you received with your confirmation letter, which provides more detail and specific for your state. In red here, we've noted two key documents within the pre-visit phase, and those are the compliance demonstration chart and the document submission chart. These two charts are really central to the pre-visit phase, and the monitoring team is reviewing evidence provided on those two charts during this phase. Data collected on the two charts, just like with Cycle 1, drives the structure of the visit that follows. So let's talk about how work on the two charts fits within the context of the pre-visit phase. First, before the first state planning call, the state will complete the compliance demonstration chart. So that's the first chart, and we're going to walk through that in detail momentarily so you know how to complete it. The compliance demonstration chart is a document that allows the state to propose its approach for demonstrating compliance with the 9 monitoring topics and will guide the process for data collection. Then, on state planning call number 1, the monitoring team and the state will discuss the approaches and make any changes or adjustments to the demonstration chart as are needed. Then, the state will complete the next chart, the document submission chart, and send it to the monitoring team along with all written materials. On this chart, again, it's called the document submission chart, the state maps for the monitoring team where to locate the documentation that was proposed on the first chart, the compliance demonstration chart. This will start the desk review process and support the development of the visit schedule. So again, the data collected on the two charts, the compliance demonstration chart and the document submission chart, are the drivers for the monitoring visit. We want to note, and this is because some states have missed it along the way, that the compliance demonstration chart and the document submission chart are included together in the compliance demonstration packet, but they are submitted at separate times during the process. And again, the compliance demonstration chart is submitted first, and that happens before state planning call number 1, and the document submission chart is submitted second after state planning call number 1. The remainder of the state's pre-visit activities focus around confirming the details of the monitoring visit. And I'll turn it to Mary to share more.
All right. The compliance demonstration chart does not need to include lengthy paragraphs, actual links, or documents. The compliance demonstration chart is a high-level document that's used to share the approach that a state will use to demonstrate compliance. It's really more of a thought exercise that serves as the foundation for the next steps in monitoring. It's a place to put your ideas for evidence down on paper. Completing the compliance demonstration chart should not take you a long time. And if it does, you may be putting too much effort into the exercise and should reach out to your regional office for guidance. For Cycle 2, the monitoring team will be sending state administrators their compliance demonstration chart from Cycle 1 to use as a reference. We're hoping that this will save you some time. However, please use that document cautiously as you complete the compliance demonstration chart for Cycle 2. You may have new regulations or policies or processes, and you also may have submitted additional evidence for Cycle 1 after you completed the compliance demonstration chart. And for Cycle 2, the compliance demonstration chart will be a fillable PDF. So now we'll review the structure of the compliance demonstration chart, which is the first part of that compliance demonstration packet handout, and we'll discuss how to complete it. Instructions for how to complete the chart are provided on the first page of the document. The chart lists each of the 9 topic areas for the current monitoring cycle and the specific regulations being monitored for each topic. And as you can see, the chart provides space for the state to document the proposed methods for demonstrating compliance for each regulation. These methods may be pre-visit documentation, which you would include in column B, visit activities, which would be included in column C, or in most cases, both. Again, the purpose of this chart is for the state to share how it can best demonstrate compliance with each CCDF regulation. And there is no need to list duplicative materials that communicate the same evidence. So you see on the screen this example for 12-month eligibility. Looking at the layout of the chart, you can see the regulatory language is provided in column A. And note there's a header in bold for the regulatory language that tells you the focus of the regulation. And in this case, we're looking at 12-month eligibility, determination, and redetermination. Column B is where the state proposes its pre-visit method of demonstrating compliance with this regulation. And then the state proposes its monitoring visit demonstration method in column C. The text in the red boxes shows examples of how a state might complete the form. For this example, we see that the state is proposing to send relevant sections of its subsidy policy manual and its administrative code for the pre-visit desk review. And then for the visit, they're proposing guided case file reviews and interviews with specific state and local subsidy staff. So you can see that very brief but clear answers are provided here, and that's great. Remember, we don't want details like the specific document names or the web links in this chart. Just be sure to include evidence for each regulation listed and be clear about what kind of evidence, broadly speaking, that it is. So for example, a one-word statement like manual in the pre-visit column is a bit too general for the OCC team to understand what the state is proposing. So what kind of manual is it and who is the audience? But including the URL for any manual is too specific. So instead you might say state licensing worker and supervisor manuals or state subsidy payment processing manual. Remember, completing this chart is the first major step in preparing for the visit. Now let's discuss some further examples of possible types of evidence of compliance that might be shared by states on the compliance demonstration chart.
Because the regulations that will be reviewed allow for state flexibility and can be implemented in various ways, the means for demonstrating compliance with the CCDF regulations will vary as well, both from topic to topic and from state to state. As much as possible, we want to see different kinds of evidence for each regulation so that we can see not only what policies and rules you've put into place, but also how they are actually being implemented by the lead agency and the counties, contractors, and child care providers that carry out the work. It's crucial to think about all provider types for the topics related to licensing and monitoring and professional development and other relevant offices and programs that you coordinate with to administer CCDF. You need to think about your CCDF program holistically when completing the chart. While we want you to think comprehensively about the evidence you'll provide, that doesn't mean that we need every kind of evidence you might have available. Be strategic and identify the resources that will provide the most direct and targeted evidence for each regulation being monitored. Ask yourself, what will it take to tell our story efficiently around this topic? If the state can demonstrate compliance in 1 or 2 documents, there's no need to submit 10. If it takes all 10 to show or convey compliance, that's fine. We don't need to see duplicative information, that is, various documents communicating the same information. Think comprehensively and strategically about the evidence and provide the evidence that most efficiently tells the story of your compliance. Pre-visit evidence is evidence that can be reviewed by the monitoring team as part of an extensive desk review prior to the visit. Examples of types of evidence that can be obtained in the pre-visit processes are state rules, statutes, and regulations, applications, and mandatory forms like provider agreements, provider emergency plan templates, and child health record templates for all CCDF providers, and manuals for licensing and monitoring, subsidy, provider training, and so forth. The language or sections of those documents applicable to the 9 topics. If your state delegates inspection or subsidy authority to another entity, the monitoring team will need to review a contract or agreements or some other form of evidence demonstration that the delegated agency adheres to the CCDF rules. Note that this list shows the kind of documents that we typically review, and we would be looking for similar documents from your state. If there are additional documents the state thinks would be useful for the monitoring team's review, include those as well. Also note that the examples here for the compliance demonstration chart are broad examples. They do not include great detail, such as no specific document name, section, or page numbers. Now let's talk about types of visit evidence. This is anything that can be observed through interviews, demonstrations, or case file reviews. When thinking about your state's proposed monitoring visit compliance demonstration approach, keep in mind who and what. So, for example, you might suggest discussions with state child care leadership team for overviews on specific topics and regulations, and then interviews with licensing and subsidy workers for the ground level view. The visit column of the compliance demonstration chart is the state's opportunity to outline your vision for the monitoring visit. So please be clear about what activities you think would provide the monitoring team with the best understanding of your program's compliance with the CCDF regulations. The monitoring team doesn't need to know the names of the specific individuals you think should be interviewed, but you do want to say which agencies, offices, or partners might be interviewed for each regulation. You may also want to specify the categories of staff you think need to be interviewed. Likewise, OCC doesn't need to know the names of the specific systems that you want to demonstrate, but be clear about the kinds of systems. See some examples on the screen. These examples show the kinds of language we typically see and the type of evidence we typically look for during the visit. However, if there is additional evidence appropriate for your state CCDF system and structure, be sure to include it. The state will need to show the monitoring team how the practices shared during interviews are formalized. For example, licensing inspector and subsidy caseworker processes, which are typically covered in interviews, might be documented in staff training materials, subcontractor agreements, staff or contractor manuals, and so forth. Ideally, states share that kind of documentation as part of the pre-visit, but can do so during the visit if needed. Personally identifiable information, or PII, is information that can be used to distinguish or trace an individual's identity, either alone or when combined with other personal or identifying information that is linked or linkable to a specific individual. Because monitoring looks at actual case files during the interviews, PII comes into play. However, cautions are observed to ensure that this PII remains secure. The state may share documentation that includes PII with the monitoring team during the on-site visit or via screen in the event of a virtual visit due to an emergency. The monitoring team will not leave with any information containing PII. If asked to send any sample versions of documents following the visit, please send blank versions. Do not send or upload any documents that include PII like Social Security numbers, addresses, dates of birth, and so forth. Here we're pausing for questions.
And we noted that Caitlin had a question earlier. Caitlin, was that question addressed fully?
It was. Thank you so much.
Okay, let me just prompt you with a question while you're thinking. Why would a state need to resubmit evidence and materials for the same topics as Cycle 1? During Cycle 1, monitoring teams frequently received revised rules and regulations and additional documentation after the document submission chart was received. For this reason, states must submit materials for all the topics, including those from Cycle 1, in their new document submission chart. OCC wants to ensure that the monitoring teams have current and complete evidence for the Cycle 2 monitoring process. And if there are no questions here, we'll go ahead and transition to the walkthrough of the compliance demonstration chart. Let's walk through that chart together and look at OCC's monitoring scope for each specific regulation in more detail. You can find that document in the compliance demonstration packet download in the bottom right-hand corner of your screen. At this point, it would be helpful to have two of the handouts available, the compliance demonstration chart and the crosswalk monitoring rules for Cycle 2 and state plan questions.
All right, everyone. So let's take a little bit of time and walk through the compliance demonstration chart and start going through some of the specifics of what monitoring teams will be looking for each topic area. So on the screen right now, we have kind of the opening page of the compliance demonstration packet itself. The next page is a instruction guide, kind of an instruction page, of course, kind of letting you know in writing how to fill out the document. And of course, as you read through that, if there are any questions at all as you begin working on this packet, please make sure that you reach out to your regional office or to the monitoring team, and they can definitely help you and get you some answers and give some assistance. So continuing on, we will start with our very first topic for Cycle 2, which is consumer education and the dissemination of information to parents, providers, and the general public. So this has two pieces to it. The first half, again, this will be familiar for those of you who have gone through cycle 1, is the posting of monitoring and inspection reports. So kind of new for this particular cycle is that monitoring teams are going to be reviewing to ensure that all states are posting 3 years of monitoring and inspection reports. Cycle 1, kind of coming fresh out of reauthorization, still, some states still getting that up and running. So now teams will be looking to make sure there are 3 years posted. So we'll also be focusing on making sure that states are posting inspection reports for all CCDF eligible providers. So that means not just licensed providers. The only one the exception would be related to all children in care. Monitoring teams will be looking for evidence both pre-visit and during the monitoring visit that the lead agency is posting the reports according to the requirements, including reports for required inspections as well as inspection reports resulting from substantiated complaints. The team is not looking for evidence of other types of consumer education. And another thing to note is that full reports must include everything monitored during an inspection. That means areas of compliance as well as any violations or non-compliances. Families must have access to information about the full complement of items monitored, and violations resulting in fatalities and serious injuries must be prominently displayed for the specific provider and clearly indicate the violation. The next piece for consumer education is posting annual aggregate data. So for this one, kind of new for cycle 2, monitoring teams are going to also be reviewing the annual aggregate data to ensure that states are posting the total number of children in care by provider category as well as licensing status. So that's something to keep in mind as you were kind of looking at your websites. This rule applies to all CCDF eligible providers, again, not just licensed providers. Our next big topic area is another familiar one from cycle 1, 12-month eligibility. Starting off again with 12-month eligibility determination and redetermination. So again, for this cycle, teams are going to be continuing to prioritize the guided case file reviews for this with a particular focus on any system updates that may have occurred since last time or since COVID. So, something to kind of consider as well. So monitoring teams will focus on seeing evidence that the same level of care is provided to the child during the 12 months of eligibility, regardless of the allowable changes in family circumstance listed in the CCDF regulations. As part of validating 12-month eligibility during the monitoring visit, the monitoring team will review individual family subsidy case records with state and local subsidy staff. And again, if we're going to be on site, monitoring teams will not remove any files from the premises. Our next topic area under 12-month eligibility is continued assistance and job search. So if the state is implementing continued assistance or job search, monitoring team is going to teams will focus on seeing evidence that it is done in accordance with the regulations and with the state's approved CCDF plan. And again, individual family subsidy case files will be reviewed during the monitoring visit. Our next subtopic for this is the graduated phase-out. And again, monitoring teams are going to be focusing to see evidence that the state is implementing graduated phase-out in accordance with both the regulations and the state's approved CCDF plan. And this will be monitored also through subsidy case file review also. Our first big new area that we will be looking at in cycle 2 is change reporting during the minimum 12-month eligibility period. So for this, monitoring teams will ensure that states have policies requiring families to report a change during the 12-month eligibility period if the family's income exceeds 85% of SMI, taking into account irregular fluctuations in income. Teams will also review whether states require families to report if the family has experienced a non-temporary cessation of work, training, or education. If states do have any additional reporting requirements, monitoring teams will ensure that those requirements are limited to the 3 circumstances described in the Ccdf regulations. You'll see them on screen, and also that those requirements do not require an office visit, and that the state is offering a range of notification options to accommodate the needs of working parents. Monitoring teams will review states' policies to confirm that families have the option to voluntarily report changes on an ongoing basis, and that states will act on the information if it reduces the family's copayment or increases the family subsidy. Monitoring teams will also ensure that states do not have policies that allow them to act on information that reduces a family's subsidy unless the family's income exceeds 85% of SMI, or, at the state's option, if the family experienced a non-temporary change in work, training, or education status. And again, we'll be looking for evidence of this through subsidy case files to be reviewed during the monitoring visit also. And the final topic under 12-month eligibility is the copayment amounts during the 12-month eligibility period. So again, monitoring teams are going to be reviewing state policies to ensure that family copayments do not increase during the 12-month period, except when the family is in graduated phase-out. And again, we'll be looking at those subsidy case files as well during the guided case file review on site. All right, so our next big new topic area for cycle number 2 is equal access. So the first piece to that is building the supply of childcare for underserved populations. So monitoring teams are going to be looking to make sure states have strategies in place to increase the supply and improve the quality of child care services for children in underserved areas, infants and toddlers, children with disabilities, and children who receive care during non-traditional hours. Evidence for this rule could include, for example, samples of requests for proposals and scoring rubrics, child care resource and referral and partner contract templates, payment policies, and data analysis reports. Our next area under equal access is sliding fee scales. So monitoring teams will confirm the development and structure of a state's sliding fee scale or scales to ensure they are based on income and the size of the family rather than the cost of care or amount of subsidy payment. So kind of the methodology behind that. Next would be waiving copayments. So for this, monitoring teams will review if states have taken the option to waive copayments for families whose income are at or below poverty level, families whose children receive or need to receive protective services, or families that meet other criteria established by the lead agency. And we'll be looking at this through individual family subsidy case files during the monitoring visit as well. Finally, under equal access, we will be looking at payment policies. So teams will be ensuring that lead agencies are paying providers either prospectively prior to the delivery of services or within no more than 21 days of the receipt of an invoice for services. Monitoring teams will review the strategies lead agencies are using to de-link provider payments from a child's occasional absences, and also will be ensuring that lead agencies are paying providers on a part-time to full-time basis and that they are paying for reasonable mandatory registration fees charged to private paying parents. So continuing on, you'll note another familiar area from cycle number 1, and that is the health and safety requirements. So for this, keeping in mind that there are a few different parts for the health and safety requirements in monitoring, this piece is very specifically looking at standards and regulations. And monitoring teams are going to be looking more closely at the distinctions between health and safety standards and the training requirements. So this is regarding requirements for the 11 health and safety topics. And again, this is about those requirements and standards, not provider training. That comes later and separately. The monitoring team will want to see evidence of the requirements for all Ccdf eligible provider types wherever those requirements exist, whether that be in statute or regulations, maybe they're in policies or provider agreements or something else. So as noted in 98.42C, lead agencies may exclude grandparents, great-grandparents, siblings if such providers live in a separate residence, aunts or uncles from the term child care providers. So that's important to note. And again, we do have a couple areas called out within the compliance demonstration chart, specifically around immunization requirements. So with that, I mean, we're going to be focusing to make sure that the state's immunization requirements for children receiving CCDF services are in place for all settings, all CCDF eligible providers, including license exempt. So that's something to keep in mind. Also for immunization exemptions, so if state is doing this, monitoring is going to focus on evidence that the state is following the regulations as well as the state's approved CCDF plan. And then in terms of the immunization grace period, monitoring is going to be focusing on the implementation of the grace period for children experiencing homelessness and children in foster care as defined by the state in all settings, again, including license exempt. So monitoring is going to also focus on the coordination between the lead agency has with other state agencies to assist families who may be struggling to obtain those immunization records. So that is the requirements piece for the health and safety. Now we will move down into the pre-service and orientation and ongoing trainings for providers. So for this, we'll start with the pre-service orientation training piece. So monitoring teams are going to be looking to see evidence that the state has established rules and policies around pre-service orientation, again, for all CCDF eligible provider staff of all provider types, including license exempt, except for relative care if the state chooses to exempt relatives. We're also going to be looking to see how these requirements are communicated. Individual provider licensing and monitoring files for different provider types will be reviewed during the monitoring visit, and pre-service orientation training requirements must, at a minimum, address the 11 health and safety topics as well as child development. So that's the pre-service piece. Continuing on for ongoing training for providers, monitoring will also be looking for evidence to make sure that the state has established ongoing training requirements for all CCDF eligible provider types, again, including those license exempt in the accordance with the regulations and with the state's approved CCDF plan, as well as how those requirements are communicated. We'll also be looking at individual licensing and monitoring files for the different provider types during the visit as well for this. It's also important to note that states have flexibility in determining what constitutes maintaining and updating the health and safety trainings, including which health and safety trainings should be repeated and what the frequency is, the number of hours, and how the state is taking into consideration each component of the regulation. And again, important to note that relatives can be exempted from this at the lead agency's discretion. So continuing on, another familiar area for from Cycle 1 is inspections for licensed CCDF providers. So again, monitoring teams this cycle will continue to prioritize guided case file reviews of the lead agency's provider monitoring requirements and practices with a particular focus on any system updates. So with this, again, monitoring is going to focus on seeing evidence that the state conducts a pre-licensure inspection as well as annual unannounced inspections in accordance with the regulations and with the state's approved CCDF plan. Monitoring teams will also look for evidence that inspections or the state's other provider monitoring activities address provider requirements for pre-service and ongoing training. And again, individual provider licensing or monitoring files will be reviewed during the monitoring visit as previously noted. Continuing on with that same theme, the next topic is inspections for license-exempt CCDF providers. And again, teams will be prioritizing guided case file reviews during the visit and be asking about any system updates or changes. And monitoring teams are going to be looking for evidence to make sure that the state is conducting annual inspections for all license-exempt providers in accordance with regulations and the state's approved plan. They'll also be looking for evidence that the inspections address provider requirements for pre-service and ongoing training, as well as all 11 health and safety topics. The individual provider monitoring files will be reviewed as noted previously. And again, for license exempt, lead agencies may exclude relatives from this. Our next big additional new topic for this cycle is background checks. So first under that is the FBI fingerprint check. So monitoring is going to be looking and focusing on observing evidence that the states have requirements in place to conduct the national FBI fingerprint check for all prospective child care staff. So background check requirements apply to any staff member who is employed by a child care provider for compensation, including contract employees and self-employed individuals whose activities involve the care or supervision of children or who has unsupervised access to children. So for family child care homes, this requirement includes the caregiver as well as any other adults residing in the family child care home who are age 18 or older. This requirement does not apply to individuals who are related to all children for whom child care services are provided. So we'll be looking at policies as well as, through the state's documentation for different provider types. So we'll be looking for that documentation. The other piece of background checks is the in-state searches of the State Criminal Repository, State Sex Offender Registry, and the State-Based Child Abuse and Neglect Registry and Database. So teams will be focusing on observing that evidence to make sure that states have requirements in place to conduct those three in-state background check provisions for the current state of residency for all prospective child care staff. And again, those background check requirements apply to all of the staff members employed by a child care provider for compensation, involve care or supervision of children, or who has unsupervised access to children. So again, same applies for family child care home, caregiver, or any adults residing in that home who are over 18, and it does not have to apply to individuals related to all children for whom child care services are provided. So again, we'll be looking for evidence through the state's documentation for different provider types, and that will be reviewed throughout the visit. Our last major topical area for Cycle 2 is program integrity and accountability. So for this, monitoring is not gathering data on improper payments or error rate. That is a completely separate information collection and requirement for states. This monitoring of program integrity and accountability will focus on internal controls, specifically the processes and practices that the state has in place to ensure subsidy program requirements are being met and to safeguard the integrity of the CCDF program. So for this cycle, monitoring teams are going to be using the Grantee Internal Control Self-Assessment Instrument and the CCDF Fraud Toolkit as a framework for asking pointed questions to better understand the efficacy of each state's program integrity processes. Monitoring teams will also be asking specifically about the COVID-related funding and how states have adapted their program integrity processes in response to the increased funding. So our first sub-piece to program integrity and accountability specifically is written agreements. So if CCDF administrative and implementation responsibilities are undertaken by agencies other than the lead agency, then monitoring teams will be checking to ensure that written agreements are in place, particularly in relation to the American Rescue Plan's Child Care Stabilization Grants. Teams will also be reviewing the written agreements to ensure they include the tasks to be performed, schedule for completing the tasks, a budget with categorical expenditures consistent with CCDF requirements, and indicators or measures to assess performance. So keep that in mind when you're filling out the compliance demonstration chart of things you'll need to submit. There are also 3 pieces to effective internal controls, the first one being the identification of risk. So monitoring for this is going to focus on seeing evidence that the state has processes in place to identify areas of risk in its internal controls and program integrity activities. There's provider and staff training, which monitoring teams will be looking at that the state has processes in place to train providers as well as lead agency and subrecipient staff on program requirements and integrity. And finally, for effective internal controls, we have the evaluation of activities. So this one's important. Monitoring teams are going to be looking for evidence that the state has processes in place to regularly evaluate its internal controls and program integrity activities. Monitoring teams will not be reviewing the state's internal control activities. They want to see and look for the state's processes for reviewing and evaluating the effectiveness of those activities. Our next piece for program integrity and accountability is identifying fraud or other program violations. So for this, we're going to be looking for evidence that the state has processes in place to identify fraud and other program violations. During the monitoring visit, the monitoring team will not be looking at case files related to fraud or other program violations. This is looking specifically for policies and processes related to identifying fraud or other program violations. Coupled with that is the next part, fraud investigation, payment recovery, and sanctions. So that's going to be looking at your processes in place to investigate fraud, recover fraudulent payments, and sanction those committing fraud, both provider and client. Monitoring does not focus on improper payments made from a mistake by a client or provider. During the monitoring visit, the monitoring team will not be looking at client or provider case files related to fraud investigations, payment recovery, or sanctions. Again, this is more your processes and policies around that. And finally, our last section is documenting and verifying child eligibility. Monitoring will focus on seeing evidence that the state has processes in place for documenting and verifying child and family eligibility for services under the lead agency's policies. Individual family subsidy case files may be reviewed during the monitoring visit. And so with that, I am going to pause briefly because that was a lot of information. So if there are any questions, we'll take a pause here. All right. Well, hearing none, then we will continue on. So now that you've learned a little bit more about how the OCC monitoring team will look at each topic and regulation and about how to approach your compliance demonstration chart, you can start working on completing the chart at any time after this training. However, please note that it needs to be completed and emailed to your regional office at least 2 full work weeks prior to state planning call number 1. So take a look at your own monitoring activities document for an estimated date for that call. Remember, for this document, you should not include any attachments, specific citations, specific links, or even any specific document name, very high level. We estimate that it should take the state team no more than a few business days to complete the chart for all 9 topics. If you need more time than that, you may be trying to put in a little too much detail. Remember, this is a high-level response to start the discussion between the state and the OCC monitoring team. You'll have an opportunity to provide more details later. If the state administrator intends to parcel out the completion of the chart to others on her or his team, we recommend that those individuals have a clear understanding about the purpose and expectations for the chart. We encourage you to share the recording of this training with them and involve them as early as possible. And before you start completing the compliance demonstration chart, we recommend that you look very closely at the Ccdf rule language that's included and make sure that you're taking a comprehensive view of what's expected of the lead agency and its Ccdf program. As you complete the chart, be sure you're providing information about each component covered in the rule. If there are bulleted items, be sure your response addresses each bullet listed. As mentioned before, you also need to make sure that you are providing information about all of your Ccdf eligible provider types, including all types of license-exempt providers and those that are licensed or regulated by other entities outside of the lead agency. Remember, you can revisit this training and the state process guide for Cycle 2, and a draft of that document is available in the downloads pod. As you begin completing the compliance demonstration chart for a refresher of the walkthrough just provided. And if you have additional questions, feel free to contact your regional office. And just in case you missed it earlier, please note that there are 2 documents within the compliance demonstration packet that you will complete during the pre-visit phase. The compliance demonstration chart, which is first in the packet, and then the document submission chart. So this is an important piece. You can begin working on the compliance demonstration chart now, but please do not complete the document submission chart until after you meet with the OCC monitoring team on State Planning Call 1, and they'll talk about the approach to monitoring and what was in the compliance demonstration chart first. So with that, I will hand it over to Mary to continue.
Perfect. Thanks, Jesse. So you all will recall from Jesse's walkthrough of the compliance demonstration chart that the topic health and safety requirements for providers encompasses 11 more detailed health and safety requirements. And then the pre-service orientation and ongoing training for providers topic looks at training as it relates to the 11 health and safety requirements. Then inspections for licensed Ccdf providers topic and the inspections for licensed exempt Ccdf providers topic consider inspections related to the 11 health and safety requirements, as well as the pre-service orientation and ongoing training on those health and safety requirements, along with how states are ensuring compliance with fire standards and child staff ratios and group size limits. As was true for Cycle 1, during Cycle 2, the monitoring team will look at standards, training, and inspections for all of the 11 health and safety topics. And also, like with Cycle 1, we'll look at standards, training, and inspections for all of the health and safety topics across all Ccdf licensed and license-exempt provider types applicable within the state. Note that states have many different terms and definitions for provider types, especially those that are license-exempt. So some examples could include registered, listed, family, friend, or neighbor, FFN, and religious exempt. But OCC monitoring will look at all Ccdf provider types. OCC will consider, as a form of alternate compliance, health and safety standards that are embedded in the state's required health and safety training. And 3 criteria will be used to assess whether a standard embedded in training would be sufficient for state compliance. So those 3 criteria are, 1, the content of the training must be comprehensive to include all of the requirements of the specific health and safety topic. 2, providers must be notified that they will be held accountable for implementing the content of the training. And 3, provider compliance with the standard must be enforceable through a provider agreement or other mechanism that gives the state authority to enforce the standard. And because of the relationships among all of these topics, the state should be aware that during the visit, the monitoring team may ask a lot of similar sounding questions as they work to gain a solid understanding of the state standards, training requirements, and inspection processes for all 11 health and safety topics across all CCDF provider types. And remember, the monitoring team will be trying to both fill in gaps in understanding and to validate information found during the pre-visit desk review. And then in addition, I also just want to highlight again that both the inspections for licensed CCDF providers and the inspections for licensed exempt CCDF providers topics also cover how states are ensuring that licensed and license exempt CCDF providers are in compliance with fire standards and child staff ratios and group size limits. All right, so I know that this has been a lot of information so far, so I'm just going to pause again briefly and see if there are any questions. So while folks are thinking about some questions, I know there was a question in the chat from Brandy about how we can find out when the first state call will be. So hopefully you received the state activities chart, and in that chart there should be approximate time frames and weeks listed out for the various activities. So if you refer back to the activities chart, you should be able to find a general week or time frame for that first planning call. Probably slightly small. Okay, so it sounds like there's no other questions at this point, so we'll go ahead and continue on. And again, you can check those as you think of them, and we'll pause one more time for questions as we move through the session here today. So this flow chart, again, should look a little bit familiar and talks about the pre-visit phase. It's, again, similar to what you saw in Cycle 1. And we talked about earlier in the session already the first tan box, the submission of the compliance demonstration chart. And now we're going to move on to the state planning call number 1. A quick reminder, folks, we are getting a little bit of background, so if you haven't already, be sure to mute your phone for us. So the primary purpose of state planning call number 1 is to discuss the state's completed compliance demonstration chart and to come to consensus on the items to send for review during the pre-visit desk review, and to discuss or demonstrate or provide during the visit. State planning call number 1 typically lasts about 2 hours, and it takes place about 4 months before the visit. And again, as we just mentioned in our questions prompt there, that your individual state monitoring activities document can give you an estimated date for that call. State planning call number 1 gives the monitoring team an opportunity to discuss any questions that you might have about the state proposed approaches to demonstrating compliance, clarifying terminology, and making suggestions as may be needed. And by the end of that call, there should be agreement about what documents and links the state will be providing before the visit for the desk review, when those documents should be submitted, and what data collection activities the monitoring team will undertake during the visit to document and to validate the state's compliance. Also during state planning call number 1, the monitoring team will provide more detailed instructions for the completion of the document submission chart. So you'll remember that's the second chart. The next chart the state will complete and submit. And using the decisions made during the discussion of the compliance demonstration chart, there will then be a brief and high-level discussion of how the data collection activities during the visit might fit into the visit schedule.
The state and the OCC monitoring team will then start thinking about how some of the data collection sessions may be organized, and we'll also start thinking about how much time might be needed for each session, how long the demonstrations might take, and roughly when they may happen during the visit. And finally, there'll be an initial discussion of visit logistics, including conversations like when should we start on day one and what sorts of audiovisual needs we'll have, and the data collection sessions as well. So after state planning call number 1, the regional office will send a summary of the agreed upon changes or additions to the compliance demonstration chart back to the state, and the state's team will then review, update, and submit the revised compliance demonstration chart based on those agreements made during state planning call number 1, and that takes about a week. The state will then identify any documents or links to include in the pre-visit desk review and complete the next chart, the document submission chart, with the detailed information related to the identified materials, documents, and links. The state submits the document submission chart along with the listed attachments to their regional office, and the completion of the document submission chart and the gathering and submission of those materials should take the state no more than a month. Between the receipt of the state's materials and state planning call number 2, the monitoring team will conduct an extensive desk review. And based on the information collected during the desk review process and the information in the updated compliance demonstration chart, the monitoring team will start to develop a draft of a more detailed monitoring visit schedule.
Mr. Bates.
So here's a screenshot of the document submission chart that we just mentioned. And again, you can find that chart, the document submission chart, in the compliance demonstration packet, which again, the draft is available from the meeting downloads. The state completes and submits the document submission chart to the monitoring team along with the agreed upon desk review materials. And like the demonstration chart, like the compliance demonstration chart, it is organized by topic and by the specific regulations being monitored within each topic. This chart gives the state and the monitoring team an opportunity to really organize and catalog the information being submitted for the pre-visit desk review. And we're not going to go into detail regarding this specific chart today. Instead, the monitoring team will provide you with additional instructions during the pre-visit planning calls, just in time when it's time to complete it. And in addition, you can watch for a little how-to mini training from the monitoring team that can help you, again, just when it's time to complete this chart. Mary?
Yep. So at this point, you will be 2 to 3 months into the pre-visit phase, about 6 weeks before your monitoring visit. You will have submitted your pre-visit materials and the document submission chart to the monitoring team, and they will have completed their initial desk review. The next step is for you to meet with them again on the second state planning call. The primary purpose of call number 2 is to refine the monitoring visit schedule to ensure that the monitoring team will leave the visit with all the evidence needed to determine the state's compliance. The monitoring team will highlight any topic areas or regulations needing additional follow-up during the visit. Additionally, you will get detailed information about OCC's process for selecting case files that will be used during the family and provider guided case reviews. As we just mentioned, during state planning call number 2, the monitoring team and the state will discuss in detail how the case files should be selected for the guided reviews. And this is a place where we've gotten a lot of questions, so we want to tell you about how it works. You do not need to leave today's call and begin gathering case files. This is just to give you a sense of what is coming. The monitoring team is going to work with you during the pre-visit phase on the details of this process. There are 2 types of case files reviewed during the monitoring visit. The first type is provider monitoring and inspection case files, and the second is subsidy case files. That is the family case files, so looking at family eligibility. For each type, there are selection criteria for the state to follow, and we'll look at those momentarily. For both types of files, know that the monitoring team is not looking for stacks and stacks of cases, nor a statistical sample. Typically, the total number of cases for review is fewer than 10 per data collection site. Also remember that this is a point-in-time review. So, for example, if a provider has been licensed since 1994, we don't need to see over 25 years of inspection history. Instead, we're just looking at recent monitoring and enforcement over the last year or so that relate to the specific criteria selected. So for the guided reviews of the provider monitoring and inspection case files, the monitoring team will conduct interviews during the monitoring visit with local licensing offices or other sites where provider inspection records are kept. And this would look different, of course, in states where the work is centralized. For each of the locations interviewed, the state will provide at least one case fitting into each of the categories that you see on the screen. Includes a fatality or serious injury, shows a visit that was a result of a complaint, shows a corrective action plan. It's important to know that a case may fit into more than one category. And across locations, the state should provide case files from the full range of provider types appropriate to the state. So including licensed homes and centers, licensed exempt providers receiving Ccdf subsidies, for example, relatives, government-operated programs, religiously affiliated programs, school-age programs, camps, etc. It's important to remember that during the visit, local monitoring and licensing staff at your state's various data collection sites will need to walk the monitoring team through each of the cases selected, showing how it fits into the category and how it demonstrates the state's processes and procedures in action, but not necessarily all of the information in the file. In addition to looking at the documentation for the category listed, the monitoring team will look at each case for evidence of required inspections, pre-licensure and annual, as appropriate to the provider type. For the guided case file reviews of the subsidy case files, the monitoring team will conduct interviews during the monitoring visit with local subsidy offices or other sites where subsidy family cases are processed. And again, this would look different in states where the work is centralized. So for each of those interviews, the state will provide at least one case per data collection site fitting into the categories that you see on the screen. So shows a redetermination at 12 months, shows continued assistance after a non-temporary cessation of work, school, or training activity, if the state chooses to discontinue assistance in those situations, shows closure before 12 months, shows initial job search if the state chooses to offer this option, shows graduated phase-out implemented at redetermination, if applicable, and finally shows a waived copayment if the state chooses to offer that option. So again, here, note that a case may fit into more than one category. And remember that during the visit, staff at the data collection site will need to walk the monitoring team through each of the cases selected, showing how it fits into the category and how it demonstrates the state's processes and procedures in action, but not necessarily all of the information in the file. And again, you do not need to leave today's call and begin gathering case files, but now you should have a better sense of what to expect. And as a reminder, the monitoring team will work with you during the pre-visit phase on the details of this part of the process.
After state planning call number 2, the OCC monitoring team will send the state an updated copy of the detailed draft visit schedule. Please review it carefully. You'll want to be sure to work with your state staff and partners to review the family and provider case file selection process and determine what steps need to be taken to have files available to share during the visit. Between state planning calls number 2 and number 3, the OCC monitoring team will continue to refine the monitoring visit schedule. Note that the final visit schedule will include the topic areas and specific aspects of the regulation that will be discussed for each of the data collection sessions. You will want to use the schedule as a guide for what to expect for the visit to be prepared for the conversations in each of the sessions. State planning call number 3 typically occurs a week or so before the monitoring visit. During this call, the monitoring team and the state's full team will confirm details about session start and end times, participant, presenter names, and so forth. This is also an opportunity to address any of the state's outstanding questions or concerns. After state planning call number 3, the OCC monitoring team will finalize and share the monitoring visit schedule, and the state and the monitoring team will both complete their last-minute preparations for the visit. It's important that states don't over-prepare for the visit. There is no need to prepare presentations for the data collection sessions. The monitoring team will conduct in-depth targeted interviews with staff and partners. These interviews are targeted but focus on processes within staff's day-to-day jobs and on validating and clarifying information provided by the state during the pre-visit desk review. Preparing for the monitoring visit shouldn't be a high-stress time for the state. Because of the collaborative processes leading up to the visit, there shouldn't be many, if any, surprises during the visit. Think of this as an open book test and not a pop quiz. After all of that pre-visit work, it's finally time for the visit. You can revisit the National Monitoring Overview Training for a high-level overview of both the visit and the post-visit phases.
Thanks, Leslie. So we're going to go into the next step. And I know this is a lot of information, so if you do have questions, please feel free to put them in the chat. Hopefully you've heard all of this and had a chance to absorb it, so we want to talk a little bit about what to do next. First, we really strongly encourage that state administrators gather your state monitoring team and involve them in all phases of the process. At a minimum, you should probably include other state-level Ccdf leadership responsible for areas such as subsidy, licensing and monitoring, consumer education, and professional development. And the OCC monitoring team will send out links for online scheduling polls. So please review those with your team and have all the key participants respond as quickly as possible. As you just heard in the session, the planning calls are a really important part of the pre-visit process, so it's critical to get them on everyone's calendars before the calendars fill up. Next, we recommend reviewing the resources that will be sent to you by the Office of Child Care. So remember that you can revisit this training at any time, and be sure to take time to review the sections on completing the compliance demonstration chart and on what kinds of evidence to propose for the pre-visit plan review and monitoring visit. Then the state's monitoring team should start completing the compliance demonstration chart. So a few reminders about the chart. Number one, unless otherwise specified by your regional office, it needs to be submitted at least 2 weeks prior to your state planning call. And if you have any questions as you're completing the chart, make sure you reach out to the regional office. It shouldn't take you too much time to complete. You'll have a chance to walk through the compliance demonstration chart with the monitoring team on state planning call number 1. So your chart should include high-level ideas and not necessarily specific details like links or document names. And then number 3, after state planning call number 1, the monitoring team will send you a summary of the agreed-upon changes to the chart, and you'll revise the compliance demonstration chart and then resubmit it. Remember that the document submission chart should not be completed until after the first state planning call. There will be time to review how to complete the document submission chart during that first state planning call. And so watch out also for a link to the mini training on this chart as well. So lastly, OCC is developing resources to help states prepare for monitoring. So in addition to what you've already received, there will be additional resources that are coming available on the website, and the monitoring team will notify you. And one of those resources will be that you can use for yourself as well as any of your state partners will be the OCC Monitoring Process Guide for states. This guide will provide details about each of the steps of the monitoring process, and you'll be able to download it from the OCC website. So keep an eye out for this resource and other resources that will be coming to you very soon. Great. So this was an overview of the pre-visit phase to help you get started with the OCC monitoring process. As we noted in the beginning, OCC teams will address the monitoring visit and post-visit during the state planning calls. We really appreciate everyone's attention and engagement. I know it's exactly 2:30, but if you have questions that we haven't addressed yet, please feel free to type them into the pods that are available. If you have feedback or any thoughts or suggestions on other trainings or resources that you might need, please feel free to type those in as well. We'd love to hear your feedback. And as always, if you have any thoughts after this training, please feel free to reach out to your regional office. Thank you all again so much for your attention and your participation today. And we look forward to kicking off Cycle 2 of the monitoring visit. Thanks, everybody.
And just to note that we will remain on the line for a few minutes here. So if you do have any questions, the slides will stay up so you can go ahead and type in your responses if you'd like.